Good afternoon, everyone, and thank you so much for joining us today. My name is Gabby, and I am here with Dr. Jill Hanson, who is board certified in allergy, asthma, and immunology at Boys Town National Research Hospital. Dr. Hanson works with both pediatric and adult patients and is here to provide tips and tricks on how to manage spring and summer allergies. Dr. Hanson, how are you today?
I'm great. Thank you so much for having me. Suffering from some allergy symptoms actually myself today. The pollen counts have been really high, so it's miserable.
Yes, definitely. I was just outside right before this, and I am totally with you. So, definitely is a timely topic. For everybody watching, if you have any questions for Dr. Hanson as we go through this Facebook Live, please feel free to leave them in the comment section below, and we can try and get them answered during our presentation. And also make sure to give this video a thumbs up and share it with anyone you know who may be suffering from spring and summer seasonal allergies. All right, so we are just going to jump in with our first question. So tell us, Dr. Hanson, what causes spring and summer allergies?
Yeah, that's a good question. So typically in the spring and summer, what we're seeing around outdoors is a lot of tree pollen, a lot of grass pollen, and then also outdoor mold as well. So most of the time, the spring, summer allergies are triggered by things outdoors, but some of the indoor allergens can actually flare up too as we get more humidity. With the exit of winter and the enter of spring and summer, we definitely see increasing humidity levels. And sometimes that will actually drive up the counts of dust mites inside the house. And so even indoor allergies can be more of a problem during this time of year. Our pets also are spending more time outdoors, and they can track in pollen and mold and things like that on their fur as well. So it's just a really hot time, I guess you would say, for allergies from an indoor and outdoor standpoint. So, and we're not 100% sure why certain people develop allergies and certain people don't. There's definitely some risk factors. Probably the biggest one is whether or not a person has eczema, or atopic dermatitis is the other name for that condition, but kind of dry, sensitive skin, sometimes real irritated, rough patches on the skin is typically what we see with eczema. And people with eczema are definitely at an increased risk of developing allergies to things indoors and outdoors, also to food allergies and developing asthma as well. But that's probably the most significant risk factor that's been identified. And then it definitely seems to run in families. So if you have a parent or a sibling or a child with allergies, there's definitely more risk for you as an individual person to also have allergies. But there are also lots of people nowadays who have zero risk factors at all, and they still develop seasonal allergies as well. So it's not a hard and fast rule. There's some pieces of the puzzle that we're missing, but in general, a lot of people do have eczema or they do have a family history.
So how are allergies developed then?
Yeah, so essentially what happens is it's kind of your immune system recognizing something as a threat that really is not a threat. So the immune system's job really is to focus on infections. So if you get exposed to a bacteria or a parasite or a virus, your immune system gets activated to try to fight that off. But what happens with allergies is your body, your immune system starts to recognize things that are totally harmless, like a tree pollen molecule or a grass pollen molecule or mold or dog dander, whatever it is. So it's essentially the immune system making a miscalculation or a mistake about a threat, and then recognizing that particular allergen as a threat and triggering release of some chemicals. Probably the biggest one is something called histamine, and that's what leads to the symptoms of allergies.
What are the different types of seasonal allergies?
Yeah, so I would say, like we talked earlier, probably the biggest ones are pollen allergy, which primarily first thing in the spring is going to be mainly tree pollen. Depending on when we start off with spring, which is different every year. Could be March, maybe could be April, but typically March or April we'll start to see tree pollen. And in Nebraska, we have a lot of trees, and so it's a huge issue around here. We see a lot of oak tree and elm tree, maple tree, pecan tree, hickory, hackberry, mulberry. I mean, there's just tons of trees around.
Yeah.
So that's definitely the top allergen early in the spring. And then that can last, late into spring, even into the early summer. And then typically we'll start to see the grass pollen start around May. So we're definitely into grass pollen season at this point for sure. So that'll go May, June, July typically, and then start to taper off a little bit. But and then the mold too, like I mentioned, is a seasonal allergen as well. And that's outdoor mold, not necessarily stuff that grows inside the house or on food or anything like that, but mold that grows outdoors on tree leaves, bushes, grass, literally everywhere outside. Mulch, rotting wood, you just find it everywhere. And that mold produces little spores that it puts into the air, and then you breathe that in and have allergy symptoms. So a lot of different things, especially in the Midwest, we're kind of in a rough area for seasonal allergies, just because we do have so many different seasons. And we have so many weather changes, and we have so many plants around. So yeah, definitely the grass and the tree pollen, and then the mold are the biggest issues for spring and summer.
Okay, makes sense. So we know symptoms can vary from person to person, of course, but what are some of the most common symptoms that people can look out for if they think they may have seasonal allergies?
Yeah, definitely. And you're right. People really do vary a lot. Some people are only bothered by their eyes, like their eyes are itchy, red, watery, draining all the time. Some people have more nose type symptoms like sneezing, a lot of congestion, or just a constantly runny nose. Some people will get drainage down the back of the throat, that they feel like they're constantly kind of clearing their throat or coughing. And then you can get itching too, of your nose, of your ears, of your throat, kind of the roof of your mouth. All of those could be allergy symptoms. Some people will get more of like a sinus infection, and if you're having sinus infections repeatedly every single spring or every single summer, that actually would be kind of suspicious for allergies. But they are hard to differentiate sometimes. So we always think about that too. If people are having a lot of sinus infections or bronchitis, or, repeatedly with a seasonal sort of pattern, we always think about allergies.
So how can these symptoms be managed?
Yeah, so the good news is there are effective treatments, so people, don't have to suffer. Ideally, if you can try to avoid the allergens, that's always helpful. But with these outdoor allergens in the spring and summer, it's really difficult. It's one of the best times of year in Nebraska, and so I think it's hard to think about staying inside all day when the weather's gorgeous. So that's certainly not realistic, but trying to keep your windows closed, running your air conditioner, keeping the windows up in your car, trying to shower, bathe at the end of the day after you've come home, just to get all that pollen and mold rinsed off, changing your clothes, taking your shoes off at the door before you come in. Some of those things can make a really big difference, but ultimately you're going to get exposed to allergens outside, probably on a daily basis in the spring and summer for sure. And so medications definitely come in where we've got a lot of different options, which is nice. We have nasal sprays, there are pills, there are liquids, there are eye drops. So we do have lots of different options to treat allergies, thank goodness. And it can sometimes be confusing to navigate all those different medicines, because a lot of them are over the counter. And so you kind of go to the store and you see this huge display and wall of allergy medicines, and it's like, oh my gosh, where do I even start? And so I think the big categories probably are the nasal steroid sprays, which would be like Flonase probably is the most common one, or fluticasone that people see around. But there are several examples of those, and they all work pretty interchangeably. And then a lot of people are familiar with the common like cetirizine, loratadine, fexofenadine, which would be more like the pills and liquids, and then all the eye drops and everything too. So, and then of course, medicines aren't the only option. There's also allergy shots, which are a really great treatment that allergy providers can offer, where essentially we're giving you what you're allergic to, trying to build up your immunity to it, so that when you are exposed, your body doesn't react. Your immune system is actually kind of tricked into thinking that that allergen is not a problem anymore. So we do tend to see a lot better control of allergy symptoms with allergy shots. So that's always a good option as well.
Yeah, speaking of allergy shots, we actually do have a question in the comment section about them.
Yeah.
And it says, hello, it has been over 4 months since my last allergy shot treatment. Do I have to start my treatment all over with shots every week or still getting only once a month?
Yeah, so that's a good question. And there's a couple of things that probably I would need a little more information on to answer that specifically for that particular person. But in general, if you've had a pretty big gap of time from your last allergy shot, I mean, I would say generally speaking, 8 to 12 weeks or so or more. A lot of times we do what's called a dose adjustment. So you may not necessarily have to start all the way over, but we probably have to reduce back into some of the less concentrated vials just because it's been so long since you've had a dose. So I would say just probably talk to your prescribing provider, whoever it was that prescribed those, just to find out, hey, do I need to start all the way over, or is it something I could maybe just cut back a vial or two and then kind of re-advance so that you're not losing all that progress that was made before they were stopped, which this was a really difficult year for allergy shots. The COVID pandemic really threw a wrench in everybody's plans and ability to get shots. So we've had a lot of patients who have had a gap in treatment. And so at least at Boys Town anyway, we have some good protocols on how to approach that.
Good to know. We also have another comment saying, do children ever outgrow allergies? My son is 2 and has had seasonal allergy symptoms this year.
Yes, it is possible, but difficult to predict. So I will say there is a chance, yes, that people will outgrow allergies. It is kind of across the board. I mean, we will see very young kids pop up with allergies and then they just eventually go away. What we probably see more commonly is kids start to have allergy symptoms, maybe like elementary school, middle school, high school ages, and then they kind of persist throughout the rest of their life. But we also have adults who have never had allergies in their lives, who come in and, in their 30s, 40s, 50s, or even 60s, 70s, and they're saying, gosh, I'm having all these allergy symptoms. We do testing and they are actually allergic. So it's very difficult to predict. There's no good way that we know of as far as deciding who might outgrow this versus who won't. There's some things that factor in, like if a person does have eczema and asthma, chances are their allergies will probably stick around for the long term, but I've seen exceptions to that rule as well. So it is possible. I guess that's the long answer to that question. It is possible, but it is hard to predict.
Yes. Okay. Makes sense. So what can families do if they find that their allergy symptoms are becoming more severe?
Yeah, so, this is a common thing that we see in our clinics, and allergy clinics certainly is, families have kind of experimented with some of the medications over the counter, which is absolutely reasonable. They're pretty accessible, relatively affordable. And so I think a lot of times people will try things like, Claritin, Zartec, Allegra, some of that sort of stuff. Maybe they even try a nasal spray, but still feeling like they're not getting relief. Mm-hmm. I think, and of course I'm an allergist, so I'm biased, but I think it's always helpful to know what you are allergic to. Yeah. And so we do a lot of allergy skin testing in our clinics just to identify specifically what we're dealing with, whether it's pollen or mold or animals, dust mites, all that sort of stuff. So we a lot of times we'll start with testing. That way we just have as much information as we can about what the triggers are. And that can give us a sense for, is this something that's going to be a problem just during certain seasons? Is it going to be more year round? What are the chances that, future allergies develop based on what we're seeing? So I think having that information is certainly helpful. And then we can kind of design a custom medication plan, or even talk about allergy shots too. And I think it's helpful to kind of discuss that on an individual basis, because there are so many different medications and there are some side effects. I mean, they're minimal, but it's just good to have that conversation and find out what have people tried, What else could we offer? Is there maybe some combinations of medicines that we need to try versus just one on their own? A lot of people come in having had a lot of troubles taking nasal sprays, which are actually the most effective allergy medicine that we have. And so a lot of times we do some just digging into, what the problems were, what were the side effects, is there a different formulation we can try, is the technique correct, all that sort of stuff that we can troubleshoot. So I think that's a good starting point for sure, especially if the symptoms are pretty severe, disrupting sleep, kids missing school, parents missing work, feeling sedation from any of the allergy medicines. I mean, those are all signs that we just probably want to get a little bit more information and try to come up with a better plan for that specific individual. And then we do also in clinic talk about allergy shots, pretty extensively, just because they are so effective. And there's not necessarily a lot of restrictions on who can do them. I mean, we can do them in young children, we can do them in older adults, and the numbers are just crazy effective. Generally speaking, about an 80% reduction in allergy symptoms, about an 80% reduction in how much medication you have to rely on, which is nice. And so we spend just a lot of time talking about the ins and outs of what that means. What does it mean to be on allergy shots? How often do you have to come in? All that sort of stuff. And so that's also helpful, I think, just for people to know that there are other options besides, the over-the-counter medicines. The allergy shots potentially are an option as well.
Yes, that's great to know. Are there ways to prevent seasonal allergies?
Good question. I wish the answer was yes. Unfortunately, there's not a lot of good data out there as far as preventing allergies from this perspective. There is some data certainly out there for preventing food allergies by introducing foods early on to infants. There's a lot of good data about that. Not as much known about how to prevent the seasonal or kind of environmental allergies. I think, if anything, since eczema is such a big risk factor, there probably would be utility, or it would make sense to try to control that eczema as well as you possibly can early on, because they may ultimately develop fewer allergies if that eczema is well controlled. And the theory is that the kiddos are probably exposed to these pollens and molds and animal dander and other allergens through their skin because of that eczema being present, and then that actually may lead to the development of allergies. And so if we can be really aggressive with use of the barrier ointments like, Vaseline, Aquaphor, kind of thick, greasy stuff to sort of seal the skin up daily, even sometimes multiple times a day, so that they're not getting that allergen contact through the skin. There are some, studies at least showing that is probably a common pathway where allergy does develop. And so there's no downside necessarily to using those thick barrier ointments. They, can be a little bit expensive when you're using them frequently. And they're not always super comfortable to wear on your skin because they are so greasy, but overall the risks are very low, and certainly the benefits are there as far as probably being the only strategy we really have to reduce allergies. I think one other thing that we sometimes read about, and it's certainly still being investigated, so this is sort of a theory, I think, at this point, but there is some good evidence for it, is that the gut microbiome, it's called, which is basically the composition of healthy bacteria in our intestines, in our stomachs, and in our small intestine and large intestine, can actually tilt a person towards being allergic versus not allergic. And so things that can throw off that healthy gut bacteria balance should be avoided if at all possible. And some of those things that have come up more recently are antibiotics. So using antibiotics, of course, if you need one, you need one. But if there's question about, is this really a bacterial infection? Is it maybe a viral infection? Could we wait this out, not use an antibiotic? There's actually probably benefit to that from an allergy standpoint, because a lot of kids that do have allergies have this past history of lots of antibiotic usage and things. And again, sometimes you can't necessarily control that because the kids absolutely have an ear infection or a sinus infection. But if it's sort of on the fence and there is an option to kind of watch and wait, I would say that should be considered. And then the other thing too is there's some studies that have shown that antacids, so like anti-reflux medicines, can actually increase the risk of allergies. So, just making sure that we have really good reasons to have infants and children, especially on antacids, is also probably something to consider. But again, these are all sort of still being studied, still in the works, where there's not a hard and fast recommendation to do things in any particular way. But I would say if you're trying to do anything possible to prevent seasonal or environmental type allergies, probably trying to limit the use of antibiotics and antacids would be on that list, along with just aggressively managing the eczema.
Very good. We have a couple more questions that were left while you were speaking. Does Crohn's disease or other autoimmune diseases make allergies worse? And if so, does the individual need to address the allergy symptoms or the complicated disorder?
Yeah, it's a good question. So both of those conditions, allergies and autoimmune disease, are kind of rooted in the immune system recognizing things that it shouldn't. They're a little bit different in that allergies, essentially your immune system is recognizing some sort of external trigger, like a pollen or a mold or a food. Whereas autoimmune disease, your immune system is actually attacking your own body. So it's recognizing some part of your own body that it is reacting to. So the targets, I guess, are a little bit different, or the triggers are a little bit different, but both are signs of kind of immune dysregulation, I would say, the immune system sort of doing things that it's not supposed to do. They are definitely caused by different pathways, though. So there are actually a lot of differences between the two. And for certain ones, certainly, there can be some overlap in the symptoms. And so I think definitely trying to make sure that you have allergies well controlled is helpful, because you may not necessarily need as much treatment for your autoimmune condition if your allergies are well controlled. So they may not directly tie into each other, but they might cause similar symptoms, if that makes sense. So an example I'm thinking of might be like Crohn's disease, for example. Many patients will experience nausea with that, or stomach upset. People with allergies sometimes will experience that because they have so much drainage down the back of their throat, and a lot of kids aren't necessarily blowing that out, they're just swallowing it, and so they may have complaints of nausea and upset stomach because of all the mucus in their stomach. And so if we're not addressing the allergy piece, we might be thinking that it's the Crohn's disease contributing to that nausea, when actually if we got the allergies better controlled, it's not going to make the Crohn's disease go away, but it might help treat some of those similar symptoms. So that's just one example, but hopefully that's clear.
Mm-hmm. Yeah, thanks for providing that. Examples are always great.
Mm-hmm.
The next question is, if taking loratadine, excuse my pronunciation. Loratadine. Yep. For long extended periods, could a person build tolerance, and will it become less effective?
Yeah, this question comes up really frequently, so I'm glad someone brought that up. So the oral antihistamines, which would be like loratadine, cetirizine, fexofenadine, some of the brand names are like Zyrtec and Allegra, Claritin, Xyzal. So they're all kind of in the same category of oral antihistamines. And there's really no physiologic reason that someone would build up a tolerance to these medications. So we don't have a great scientific explanation for that, but just anecdotally, I have patients tell me that all the time, that they feel like they've been on one for a really long time and it just doesn't seem to work that well. So they switch to a different one and then it seems to work better. So I can't say that I have any scientific evidence to support that, but just based on practical experience, it does come up a lot. And so I think that can be a step towards, just even at home, if you're kind of noticing, gosh, I don't feel like my allergy medicines are working as well, I'll switch to something a little bit different. Makes some sense. And if it helps, that's great. If it doesn't help, sometimes it can just be a sign that maybe that person needs more than just an oral antihistamine. So, for example, like the nasal steroid sprays, like I mentioned, are just again and again have been demonstrated to be the most effective allergy medicine. So really, if you're struggling at all with allergies and you're not on a nasal steroid spray, that's probably the first step, would be to go ahead and start one of those. They do work best if you take them every day that you're experiencing symptoms. They don't work as well taken as needed. So they are kind of a frustrating medication to use sometimes, but they are very effective when used on a daily basis, kind of during your allergy seasons, or if you're symptomatic, having problems all year long, taking those every day all year long is also acceptable. So yeah, I would say with the antihistamines, the oral pills or liquids, kind of experimenting around with different ones. Sometimes you just have to find the one that's the right fit for you. But if you're still noticing symptoms, probably the way to go would be to add that nasal steroid spray.
Great. So are there any considerations for giving daily allergy medicine like Zyrtec for kids over time? We have someone saying that they don't know when or if they can stop giving medicine.
Yeah, sure. Yeah, so fortunately with the allergy medicines, they do have very, very good safety profiles. So, I mean, really with any medication, you kind of have to weigh the risks and the benefits. With any sort of decision, I guess, you kind of weigh risk and benefits, but with medications, there is a risk to not taking the medicine, certainly, and having poorly controlled symptoms. There's benefits to the medications, certainly, of controlling the symptoms, improving quality of life and things like that, just your ability to function with allergies. And so with the side effects being so minimal, I think for the most part, for the vast majority of patients, the benefits of taking medications are definitely going to outweigh the minimal risks, even for the long term. The oral antihistamines, and I should say specifically the second generation oral antihistamines, which would be like the Zyrtecs and Claritins, Allegra, Zyzols, those are called second generation. So they're newer medicines. They're 20 plus years old, probably, if not more, but they are relatively new compared to the first generation, which would be like Benadryl. And we do know Benadryl does have side effects, concerns about long-term use if it's regular, but the second generation are much safer, and we really don't have a lot of concerns about long-term use to control allergy symptoms. The nasal sprays are also very safe. They are a steroid, but such a small amount is actually absorbed into your bloodstream that the side effects are minimal, even with daily use for years and years and years. So, and I think, kind of makes sense. The spray is going into your nose. It's not going into your mouth or your bloodstream or anything like that, where it's going to get absorbed. So, so we are lucky in that way, that allergy medicines are very safe. They are effective, and they can be used for long-term, years and years and years if needed. Now, I will say it is reasonable to try to wean off of those medications sometimes and just get a sense for, is it something I still really need? And I think there is some value to that. You'll notice the symptoms coming back, certainly, if you need them. And that's also somewhere that allergy testing can come into play, is if we can identify, oh, yes, you definitely have allergies, and here's what they are. We can at least give you some confidence that you're taking allergy medicines for a good reason. Versus if you turn out to not have allergies and maybe it's triggered by something else, other medicines might be more appropriate. So just again, kind of going back to that idea of sort of knowing exactly what the triggers are and knowing what you're treating, I think is one of the advantages of having testing done.
Yes, definitely. Thanks for answering that. So
Sure.
This is another common question I'm sure you get. How can we tell the difference between a common cold and allergies? And maybe,
Yes.
relative to this year and last year, COVID-19.
Yes. So this is a real challenge. The symptoms of allergies that we kind of reviewed overlap a lot with the common cold, which can be a runny nose and sneezing and congestion, and you can even get eye symptoms sometimes with cold. So I think it can be very difficult to differentiate. Generally speaking, allergies don't cause a fever. But you've probably also heard the term hay fever, which is sort of an older term for allergies, because some people with their allergies do get kind of a low grade fever, but it would be unusual for it to cause a fever of like 101 or higher. So if a fever of 101 or higher is present, it's probably more likely that it's an infection and not allergies. And I think too, just the duration of them, so how long the symptoms last. I mean, typically a cold is gonna, you're gonna feel pretty miserable for 3-4 days, and then it's gonna kind of improve and things will get better. Allergies can do that too, but if it's something like tree pollen or mold that you're going to get exposed to every day during a whole season, it's probably going to linger on for quite a bit longer than the common cold would. And colds can even linger for 10 days, 14 days sometimes. So that can be a challenge, but yeah, I think it is difficult. There's not a lot you can see even on an exam when you're looking at a patient, because colds can cause big swollen tonsils. They can cause a red throat. They can cause drainage down the throat. They can cause swelling in the nose. So they can look really a lot like allergies. And so it can be very difficult to sort out. But I would say the fever is probably the biggest differentiating factor. If people are having like body aches and fatigue and things like that, that may be more likely to be infectious. But some people can feel really miserable with their allergies too. So, if there's uncertainty about it, especially if the symptoms keep happening again and again and again, I would say, talk to your provider. And one other thing too, I just thought of would be with allergies versus a cold. If nobody else in your family is sick with a cold and you're the only one, that kind of makes you wonder too about, well, maybe this is actually allergy related and not an infection. So, but yeah, it can be difficult for healthcare providers to distinguish. So I think it can be really hard for patients. So I think if there is any uncertainty, just always talk with your doctor or your healthcare provider.
Yes, definitely. So how can Boys Town's Allergy, Asthma, and Immunology Clinic help families who are dealing with seasonal allergies?
Yeah, absolutely. We are the experts, I would say. We, anyone who's a board certified allergist has gone through an additional 2 or 3 years of training after their initial training in pediatrics or internal medicine, just to specialize specifically in allergies. So I think it's sort of our niche area. It's what we do. And so we would like to think we're very good at it. And so I think, certainly the skin testing is something that's pretty unique to allergy clinics. So if you're interested in having skin testing done to try to find triggers, that's something that we offer in our clinics. You do get the results the very same day, which is nice. So you come in for the testing. And as long as you've stopped the appropriate medications and everything, which we always review when you're scheduling the appointment, the testing takes about 20 minutes or so, 25 minutes, and then we can actually review the results with you right away, which is nice. So we can give you that feedback immediately and then come up with a treatment plan as far as medications and potentially allergy shots and everything too. So we do have 2 different locations in Omaha. Our main Boys Town campus out west on Pacific Street, and then also on 72nd and Center. So we do have 2 locations, and we give allergy shots at both of those locations as well. And there's 2 of us, 2 allergy physicians, and then we have a great nurse practitioner as well who has a lot of experience in allergy. So we are busy right now because it is our, sort of our peak season, but generally speaking, we're able to get patients in within a reasonable amount of time to address these issues.
Great. Yes. So I will make sure everyone watching to link our allergy clinic and all of the information about it in our comment section below. And then I will also link how to request an appointment with Dr. Hanson. So if you want to see her in specific, I will make sure to put that there as well. So thank you, Dr. Hanson, for all of your knowledge on this topic. We really appreciate you providing so much insight and helping people live in our comment section. That is super, super great. For everyone watching too, if you are looking to hear more from Dr. Hanson, she was recently a guest on the Raising Good Parents podcast with Dr. Phil Boucher. So in her episode, she talks more about food allergies and intolerances. So if that's something you are interested in listening in on, I will also put that in the comments. And yes, so thank you everyone for joining us, and we hope you have a great rest of your day. Thank you.
Thanks. Take care.
Bye.